make a little video on voodoo flossing because this is something that's come up and it's very useful as a mobility tool, especially if you're trying to relieve pain around various joints. And this works really well around knees and elbows because they're often quite difficult joints to mobilize, but this creates what's known as a global compression, which means it's just squeezing all the way around the joint. I'm going to show you guys how to do it on the elbow today. So this is Benji, and Benji, super strong athlete, like strongest guy in the gym pound for pound, but sometimes struggles with a little bit of elbow pain. We'll make another video on his shoulder pain in a sec, but we're going to go and attack his elbows. So just show me your elbow range at the moment, okay, and just hold it up to the camera so you can see. All right, so he's got we'll go pull this around, so side on. So like fairly good elbows, but you can see could be a little bit straighter. And also we're going to go and look at the retest. That's just like the test. Yeah. So then, and the way you want to do this is start off distal from the joint, so sort of downstream, and then I'm gonna wrap it all the way up. And you're looking for about 70% tension. So the way that you do this, I'm going to do this. I don't want to block the screen. You're going to start off here. If you step closer, then we can probably get a better look. So then you pull to about 70% tension. Now, obviously, with an elbow, you need a partner to do this. You can't do this on your own. So you need someone that knows what they're doing. 70% tension, pull it tight, wrap it around. And then this is not the end for Benji, because what we're going to do is we're then going to, so
I can already feel that.
So a good sign with this is you want to check blood flow, and I'll show you how to do that in a moment. But basically, the moment that Benji goes, you need to take this off, that's usually a good sign again, take it off. So in terms of how long should I keep this on, but you need to make sure that you've got enough stretch on that band that he's going, that's tight. And that's usually the right.
Yeah, I could definitely feel that. Definitely feel that.
Right. This relieves a lot of pain. So now Benji, what you're going to do is you're just going to move it back and forth like that.
Yeah.
So, and it's just going to like squishing all that muscle tissue around all the fascia, and it's forcing any kind of laminations, so like soft tissue laminations where they're stuck together, apart, just by him going back and forth. And he's actually doing very well because most people like struggling to move it. But I certainly see if you're fixing like things like tennis elbow or golfer's elbow. So tennis elbow is usually on the top, golfer's elbow is usually on the inside. Either of those things both those things can get fixed or helped alleviated somewhat by doing this. So yeah, we're going to keep it going.
That's pretty nasty.
Yeah, so the way to check if it's been on too long is blood flow. So look at the palm, and you push on here, and you can see, so you see that's like still sort of, it's still white. That means that the blood flow is cut off, so it's probably time to take it off. So if it comes back, you know you're safe. Well done, Benji.
Pins and needles.
Yeah, well done. There we go. So there. Now, do be prepared for some bruising. But now, if you look at the tissue just here, it goes all red because all the blood suddenly rushes back to that area. Right. Now, just move it around back and forth and see if that feels any different.
Yeah, it feels so much looser.
It feels a lot looser. Yeah. So that's for the just voodoo flossing the elbow. I'm going to show you some other joints, but it's very useful for you guys to go and know how to use this. It's a very cheap tool to get hold of. They're about £5 each, maybe a bit more, that you can alleviate a lot of pain without having to go to a sports massage therapist. So learning how to use this, very important. Let me know if you've got any questions in the comments.